Hi, the topic for this video is suicide precaution. I will be talking and explaining a lot of things, so I need you to bear with me. Before getting started, I think it's best for me to explain the ideation of suicidal thoughts. Without us knowing, actually, people around us, many of them that has experienced suicidal thoughts, especially during their stress period or the period when they are mentally or physically challenged. And suicidal thoughts are actually a symptom of an underlying issue. The most common that I have heard of is financial problem, and also maybe relationship, the problem with their family or friends or partners. Talk about treatment in suicidal patients. There are, of course, there is treatment available that is effective in most cases, but first thing that is very important is to make sure our patient to reach out and ask for help. Now we'll be talking about the signs to look for in a depressed patient that might be having suicidal thoughts. The first thing that you will straight up notice in a patient is their facial expression. They are most of the time sad and they express it, and then the patient might be sleeping a lot more than they should, and they have low energy, low motivation. They don't want to do things, they don't want to maybe they simply look like they want to end their life at that moment in time, and they have no appetite at all. Now these are 5 steps on how you can actually offer help to a suicidal patient. The first one is to ask. You can casually ask them, hey, do you perhaps have any suicidal thoughts lately? And if they say yes, and you can ask them, can you tell me how are you hurting, or what can I do to help? So secondly, you have to be there for them. Now this is kind of obvious, but once you have asked the patient and they are ready to open up, then you have to be there for them to actually listen to what is troubling them. And yeah, thirdly, you have to keep them safe. If it is mentioned by the patient, if they have previous suicide attempt, and they mention it, how do they imagine the suicide will be like? For example, do they cut themselves? Do they tie themselves around their neck with rope, or do they actually have tried to jump off a building? So ways to keep them safe is to prevent them from getting into the kind of situation that they have imagined. To actually really keep them safe is by seizing sharp things like a razor or a blade or a cutter. And if they ever tell you that they have imagined themselves jumping off a building, then you should prohibit the patient from going to the hospital's rooftop, and yeah, that kind of things. Next, you can help them to reconnect to whatever thing that is troubling them. For example, if they have problem with their relationship with their family, then you can have their family to come and make them discuss about things. And lastly, you can follow up the patient's condition from time to time. You should always have the asking session, like, hey, are you okay now? Can you tell me how are you progressing? Do you have any more suicidal thoughts? And yeah, that's how the 5 steps of helping a suicidal patient.